a number is ever released, because by the time the point in time count is released, there's so much happening before then. There's a lot of trainings, there's a lot of pre-meetings, a lot of gatherings, a lot of questions, a lot of data collection, data review, analysis. And so although the point in time announcement is important, and you'll have to come back for that, hopefully in June, this is also a really, really important part of the project. So just really quickly, at the Coalition for the Homeless, we serve as the lead agency of the Homeless Response System, also known as the Continuum of Care. Part of the role of being lead agency of the Continuum of Care is that you have to host or hold the point in time count. A lot of COCs do this differently. Our COC does this annually, while other COCs host a point in time count biannually. That's actually the HUD requirement to do it every other year, but we do it every year. So the easiest way to explain the point in time count is that it is one important view of homelessness, but not the entire view. It's not the whole story, but it is an important part of the story. The PIT count looks at people experiencing homelessness per one definition. This includes people in emergency shelter or people experience unsheltered homelessness identified during the count. But I also want to be clear what it's not. The PIT count is not a full census of every person experiencing housing instability. It does not fully capture people living doubled up or with family or friends. And so it should not be the only way we understand homelessness or housing crisis in our community. So that's what this snapshot here is. You often hear me describe the point in time count as a snapshot. A photo can be accurate, as you can see, but still not show everything outside the frame. That's how I think about the PIT count. It gives us a real picture of a real moment, but there could be a lot of things happening behind the scenes. So when we talk about the PIT count, there can be two truths at the same time. The count is valuable, and the count has limits. It tells us something important, but it does not tell us everything. That is also why comparing PIT counts city to city can be challenging and tricky. Communities across the country hold the point in time count in different methodologies. Our point in time count has held the same methodology pretty consistently over the past few years, but there are other methodologies across the nation. Some people host the point in time count in one day, some people host it across a week's time, some people host what you call an HMIS service count, which is everybody within the Homeless Management Information System. So it can look very differently. So when people ask, how does Houston compare to other cities? That's a fair question, but you have to answer it with context. Our approach reflects our region. All right. So the Way Home, for those that don't know, covers a 3-county region. This is Harris, Fort Bend, and Montgomery County. We are 3,600 square miles, a little bit more. And somebody said this earlier, I think you could fit 25 states into our COC region, which is pretty incredible. That is why we do a 3-day count, because we really couldn't host this in one day. We assign regions. So we break off our entire 3-county region into very specific map areas. We train volunteers. Training is such a huge part of this process. We probably host 10 to 15 trainings starting from the start of the count to close to coming to when, starting from December, close to when the point in time count starts. Many years, this effort includes about 75 partner agencies to about 400 to 500 volunteers. People often ask, what is the hardest part of your role? It is the point in time count for me, because there's so many variables. You can't control those X variables. There's the weather that can be an issue. There's volunteers not showing up for their assignment. And so there's a lot of process and planning that goes into the point in time count. Planning often starts with a smaller team within our organization. So we'll go through annually to learn from best practices from the year before. We often do a survey post-PIT that kind of tells us, hey, this is the experience that happened the year before. These are things that worked, that didn't work. And we will shape our next point in time count to better reflect those survey responses. We also, in the planning, we do a lot of volunteer recruitment, and our public affairs team will work a lot with our local elected officials to make sure elected officials are engaged, and if they want to count their specific region or area, we'll make sure that that happens as well. Volunteer, as I said, is a big part of this process, because without the volunteering and the partner agencies, we wouldn't have such a successful count. Volunteers have to know where to go. They have to be trained on how to engage with an individual who may not have ever talked to somebody or may not ever want to talk to somebody. So that is a big piece of this that my colleague Tony Benson Atkinson will talk to a little bit more in just a second. We, again, do so much with the work with elected officials and just working within this 3-county region that a lot of the praise and the success of the point in time count really comes down to those partner agencies and the volunteers across the region. Next, I want to touch base on how the point in time count happens a little bit behind the scenes in what we call the command center. On the technology side, we utilize an app called the Counting Us application through SimTech Solutions. This application is a live application. So while volunteers are out, they're assigned their region, but we can see as the volunteer, because they have their geolocation on, where they are within that region. And we can see whether they are conducting live interviews or if they are marking what we call an observation within the count. This really helps us with real-time, again, coordination and give us an idea of how the volunteers' patterns are. So if we see a volunteer that has frequent observations, that tells us that that volunteer needs to be contacted, and maybe that volunteer is having some sort of safety concerns, or they need some backup. So we usually will deploy one of our, what we call pit captains out to get an idea of what that volunteer is engaging to make sure that they are safe and then troubleshoot any issues. Again, even with all this planning, there are still many variables. Field conditions, technology, sometimes technology and Wi-Fi or internet goes out, volunteer participation, and most importantly, it is up to the client to engage with us. The client could say no, the client can walk away, and that is totally okay. The human piece of all of this is extremely important. We are working with people, and they are important. Behind every data piece is a person. And many of these people have been filled by multiple systems within their journey. And so we need to be very aware of that as they approach the homeless response system. That is why the PIT count matters, but is just one part of this work. We also use HMIS, Coordinated Entry, outreach engagement as other forms of data throughout the year. Across the year, more than 40,000 people probably enter some sort of service within the homeless response system, within just our general homeless response system. That doesn't count the domestic violence system, which has their own, due to privacy matters, that probably has 30,000 people that are engaging within services. And so that is really an important data point to just lift up, because although point in time count is important, again, it doesn't tell that full story of that data element of the full picture of individuals experiencing homelessness. So the PIT count, as you will hear a bit more today, it is important, but is not perfect. It tells one side of the story, but not the entire side. It is very meaningful. And we are very lucky to be in a region that has so much support within our point in time count planning, but there's a lot of work that can be done. and a lot of engagement efforts. And here, next, I will turn it over to Tony Benson Atkinson, who will talk about the outreach. And hold on, let me tell you a bit about Tony.
Well, she makes her way up.
Tony Benson Atkinson serves as the Director of Program Operations at the Coalition for Homeless, where she oversees the landlord engagement, housing, and outreach teams. Since joining the organization in October 2019, she has played a key role in advancing system-wide strategies to strengthen community partnerships and improve service delivery. In her current role, Tony helps lead the planning and implementation of housing programs, engagement, and outreach initiatives in collaboration with system partners. Tony is originally from Stafford Springs, Connecticut, home to the Stafford Motor Speedway. Wow. Where she recommends catching a demolition derby at least once. Thank you.
Not a big microphone speaker. Before I get started, I just want to say while we all play a role in pit count, Renee really is our captain, so she really leads our work, and she really deserves just a big round of applause for the work she does. So I'm just here to talk a little bit about the groundwork that's happening during PIT. So what's going on when we're actually out there. For a lot of the volunteers, oh, I feel like this is so loud. For a lot of the volunteers, it really gives them like a peek into what outreach does every day. But there are some differences between pit counting and actual outreach. One of the main differences is, we're not out there providing the normal services. We're not out there doing assessments. We're not out there transporting clients. We're not out there to get you a new ID. Not to say we won't do it, but that's not our primary focus when we're doing pit count. And also, our conversations aren't as casual. They're not focused on building a rapport, because we're actually trying to get information. So we're not out there, we do spend a lot of time with our clients. Sometimes we'll spend a whole day with a client, but this is more of a, hey, we got to get this information today. I'll come back out and check on you tomorrow. We're still providing hygiene kits. We're still giving resources. We're still providing any other kind of essentials, but there are just, a few differences. One thing that is the same for volunteers and the outreach workers are the challenges that you come across when you're out doing the pit. They're just daily challenges that we see when we're out there every day. There's safety issues, of course, which are like aggressive clients and aggressive animals. There are a lot of animals we come across. Health emergencies, and unfortunately, sometimes we even have a death when we're doing the pit count. Also going to talk a little bit about the coordination of teams. It's not easy. Like Renee said, we get started pretty early because we are working with outreach teams from across the systems. We have outreach teams from healthcare, we have outreach teams from the DV, we have outreach teams from veterans, so we're working with our system outreach partners, so it takes a lot of coordination. Also, outreach are assigned maps. So they don't get to choose, they don't get to go in there and go, oh, I want to be in this section. Nope, we pick where you're going. And we do that based on maps that we know have more unhoused populations, off of areas that we know, encampments that we visited, and also just the size of them. Sometimes we got some really big maps that we know outreach can cover. So we try our best to keep them in the areas that they typically do outreach in, so that way they might come across some familiar clients. And it might be a little bit easier to have that conversation and to ask them those questions. But we can't always guarantee that. And also, since we have larger teams on outreach, we typically have anywhere from 4 to 12 outreach members per team. We can assign them those larger maps, or as Renee was saying, if there's an issue that comes up or someone's not going to be able to finish their map, we can call our outreach teams and be like, hey, we're going to add another map to you. Yeah, they don't like it, but we do it. So that's, yeah. For the communication during the pit, because when we got to call them and say we got to add another map, just like Renee was speaking about, we also have an outreach command center. So there are 2 or 3 of us that are sitting at our computers all day. We're doing the check-ins with our outreach members. We do 3 different check-ins. We do a morning one, an afternoon one to see how things are going, and then we do an evening one at the end to wrap it all up. And of course, we're always available for any kind of emergency, any questions, to address any issues they have, and we're also sitting there monitoring their responses in real time. Just because they're outreach workers doesn't mean they're not going to do an observation. We will call them and say, hey, what's going on? Like, you guys should not have this many observations. So yeah, we'll do that all throughout the day. So another thing that I'm going to just talk a little bit about is how we use the PIT data for outreach kind of before the results come out. So we kind of get a little sneak preview. Like this year, we use the geolocations for people's responses to kind of try to identify hotspots and encampments outside of the loop. So John played a big part in that, using those geolocations to see within a certain specific, like I think we did 500 feet or something, how, like, if there was a group of people, so that we could go out there and address it as a hotspot or encampment. And then in the past, we've also tried a reverse PIT, which was used to identify people who gave responses that were in HMIS that we needed to reconnect to services. So we would go out there and see if we could locate them and say, hey, you know, we caught up with you during the PIT. We'd like to go ahead and get you reconnected. You know, what do we need to do to get you moving towards housing? Sometimes it really is just as simple as when we're out there, we come across a client that we've lost. I know that sounds weird to say we've lost somebody, but sometimes you just lose connection with them. So sometimes when we're out there, if we're able to find them, it's a great time for us to go ahead and reconnect them with services and say, hey, let's call your case manager, or hey, meet me at search tomorrow. So we really, you know, while we're out there doing the PIT, we don't forget that we're outreach and we have a job to do. So we might put it off for a day, but we're gonna go ahead and get you guys reconnected. And that's it for me. I'm going to go ahead and pass it back to Renee so she can introduce your next speaker. Thank you.
Thank you so much, Tony. Awesome. All right, John Slimp. John Slimp is a data systems engineer at the Coalition for the Homeless. His role involves detailed data analysis, maintaining dashboards, and creating data integrations between Coalition for the Homeless and other partner organizations. His background includes work in software consulting and IT for a total of 10 years. I'm gonna pause really quick. John started with us 3 years ago. John knew nothing about the homeless response system. And he has learned so much to the point that he now can assist partners and see the bigger picture. And so we are so proud of John and so happy that somebody on the data side of it, the technical side, he probably could be making 3 times as much money as he does here at the Coalition. But it's true, and it just shows, you know, when you have the heart for something, it can really make a difference, and he's really made a big difference in the system. His hometown is San Antonio, Texas, Countdown City, shout out. Go Spurs. If you've ever been, he says the Riverwalk area is definitely worth a visit. If you've been to the Riverwalk, then check out Pearl Farmers Market. John.
Thank you, Renee. I'm a move-aroundy kind of speaker, so I'm going to move around. Right. So for my section of this, some of the goals up front, we're going to talk about a little bit more of the nuts and bolts of like how the data gets captured and analyzed, although Dr. King's going to go into even more detail than I will, so I'm going to leave a lot of that to him. I'm going to touch again on how the PIT is a very useful tool, but has limitations. And then also I'm going to tell you about kind of the broader data that the Coalition uses in the HMIS. Now I know nobody here knows what the HMIS is, but we're gonna talk about it anyway. So kind of as Renee had in her first snapshot photo, you might have seen it had a section at the bottom that said the unsheltered count and the sheltered count, right? Most people, when they think of the PIT, they think of the unsheltered count, right? But really, there's 2 parts to the overall number. And so, of course, the unsheltered count, as has already been discussed, we use Counting Us to get that number, the mobile app. Something we do every year, or at least I think we've been doing it every year, is we will review the actual interview questions. And we do that with Dr. King and our teams for a couple reasons. Number 1, we have to make sure that we are meeting HUD compliance for what we have to report to them. And number 2, Dr. King does this extra analysis for us, and we want to make sure that some of the questions we're asking support some of that downstream analysis that we are doing. And also, we do make a pass for conciseness because, you know, if you have a big, long survey, it's much easier for a client to be like, well, whatever, I don't want to do this anymore, and then you have a data quality problem. And then as it relates to the sheltered count, we actually get kind of two main data sources for the sheltered count. We will pull data out of our HMIS, and we will receive data from our DV partners. A little bit more on that, on the HMIS part in a second. Of course, we touched on interviews and observations and all the live monitoring we do to make sure people are staying in their zone. And then for the HMIS data pull, we're looking mainly at emergency shelter, or clients enrolled in emergency shelter, clients in transitional housing, which is a kind of temporary housing that lasts about up to 2 years, but it's kind of meant to be a bridge. And traditionally, when we do reporting in the HMIS, we consider those people to be literally homeless. So that's why they're included in the sheltered count. And then, of course, safe haven, which you can think of as a kind of shelter for people with very severe needs that do not otherwise meet eligibility criteria for other kinds of programs or don't really go to other emergency shelters. So those are the sources going into the HMIS poll. Oh, you're gonna get it all at once? No, you're not. Okay. So after we've done the count, we do some post-processing before we hand it over to Dr. King to ensure that we've got good data quality and accuracy. So of course we will make a pass to deduplicate, right? If 2 surveys came in for John Doe, who was born in 1951, in the same spot, we do not want to count that person twice, and we will archive off anything that we find to be a duplicate. We won't outright delete it, but we will archive it and not count it as part of the PIT. And so that's just sort of a refinement process. Every once in a while, an interview gets in there for a person that's not actually homeless, so we archive that too. And we just make a pass to kind of refine the initial data set. We then take a look at our observations. So we do train our volunteers on what counts as a valid observation and what doesn't, and we specifically call out if you are riding a bike, or you are in the median, and that's it, or you are panhandling. That does not mean that you're homeless unless you literally go up to that person and ask them whether or not they're homeless. And we still get some of those observations every year, and so we make a pass on all of our observation data to archive those. We keep the vast majority of our observations, like 90-something plus % of our observations we keep, but we do take a look at that. Then we undergo an HMIS matching process. So my HMIS director, who is not here, the infamous Errol, or maybe famous, he will do a very labor-intensive process of essentially pulling up interviews, looking at the name, the date of birth, the demographics, and trying to match that interview with the person in HMIS. So imagine that you're doing the pit count and you got like cars going by and like construction and like you need to use the bathroom and they need to use the bathroom. It's like really hard to stay, it can be hard to stay focused, and you might miss someone's name entirely. You might put a bad letter in there. You could get their date of birth wrong. So as you can imagine, that can make it really hard when we're sitting in a quiet, cool office room. When we're trying to match people up, it can be really difficult, and we will have to make judgment calls, right? If a name is off by a letter or the date of birth is off by a day, right? These are the kinds of things that we have to make our best call on whether it's a match. So that's a very labor-intensive process that Errol will go through. And then finally, for the data that we pull from the HMIS, we double, triple ask our providers to please make sure it's up to date for the night of the count, so that when we pull it, we have the best representation of that number from those shelters that we can possibly get. And so we kind of bug the heck out of them until they've updated their data. So I'm going to talk a little bit about the HMIS, because the pit count is great, but as far as the day-to-day, it's our HMIS. I'm going to maybe kind of breeze through this section because I think most of you know what's up with the HMIS. Of course, we have enrollments. Those are our bread and butter. This helps us answer those questions of like, who is engaging with us? When did they engage with us? When did they stop engaging with us? We use it, enrollments for shelters tell us literally the pit is what we rely on for the pit. Enrollments for housing projects tell us who is housed, who is losing their housing, and kind of the overall state of housing at any given moment. And they're sort of the main body of data that we use, but kind of to support it, we also have assessments, which are exactly what they sound like. When a client is first enrolled, we will essentially ask them questions to assess what is your situation, what are your needs, how vulnerable are you. And we will also do assessments every year if they remain engaged with the system, and then also when they exit. And assessments help us answer those questions of like, are people actually improving in their outcome? Like, did we help or did we not? And is their situation changing over time? Then we have services. Services are the most granular piece of information we have in the HMIS. Each service has a date and what we did. So services like case management. I gave case management yesterday, or I gave a hygiene bag, or I gave a shower. These kinds of things tell us what are the main services our clients are using in the system, and that not only does that tell us what are they doing, but also the kind of the monetary piece, right? Like what is the load on the system from a monetary perspective, but also it tells us how frequently are we engaging with our clients, right? Like if we want to make sure we have case management services logged for our clients, in a timely fashion and frequently. And so I'll just touch on it real quick. I also just want to talk about coordinated entry. This is not a specific piece of data, but it is a section of our system data, and it is our approach for a no wrong door, facilitating a no wrong door to our system. And the idea is by enrolling in coordinated entry and being assessed in coordinated entry, you can eventually be connected to the services that you need and that we see that you have a need for. And so you can see how all of this information paints a much more detailed picture than the PIT does. And so you'd be tempted to think that the PIT maybe isn't as useful, but even though it doesn't paint as detailed of a picture as the HMIS can, that doesn't mean it's not still a decent tool. So here are some real quick problems that the HMIS can run into. Some of the data in the HMIS is really difficult to keep up to date. Sometimes we will meet a client on the street, enroll them, and then never see them again, or not see them again for 6 months. And from a data entry standpoint, that enrollment is accurate, but it's hard to go 6 months later and say, that's definitely the situation of that person still. And then also, sometimes there's so much data, like let's say there's a client who has 15, 16 enrollments that have started and ended over the last 3 to 5 years, and it's like, there's so much data there that it becomes very difficult to draw a conclusion from like, what is happening with this person? Why are our interventions not working? And so then it's like, okay, that's very complicated. So to try and explain why the PIT count is useful, I have an equation for you, okay? We're going to math school. And so we see A plus B plus C equals D. Now notice the equals is a wavy equals. The wavy equals, you may recall, means approximately equal to, okay? So let's say on the left-hand side, you've got our homeless response system, kind of what we provide, how effective we are. And on the right side, you have no wait, caveat, wait. I'm not saying that they're the same, okay? Don't go taking screenshots or photos, okay? The caveat is this. We all know, everybody here probably, that the homeless response system is much, much more complicated than this. And you know because I bold, italicized, and underlined the word much. But here's the idea. The idea is if you keep the PIT count the same every year, year over year, it becomes a measure for the system output. Right? The idea is if you can get better and better at capturing the same quantity each year, then year over year, you have an insight into the other side of the equation, the system. And some of you are going to say, hey, John, what if like you don't change the system, but the PIT count goes like way up? Well, that would point to things happening outside of the system, right? Economic factors, seasonal factor, a hurricane, like any number of things that happen here could be pointing to explaining why it is behaving that way. But overall, the pit count, with all its limitations, right, it is still a useful tool and kind of indicator for overall system health from year to year. So that's kind of how I wanted to explain that way. Here we go. And so finally, this is my last slide. So you may be asking yourself, okay, that's a lot of data. How on earth do you use it, right, to make decisions for your system? Well, systems are dynamic, and they have to adapt, right? And adaptation usually looks like reaction and also being proactive. So on the reactive side, you have all the stuff that you've come to expect from a system, right? You're going to analyze your data. You're going to look at who's coming in, who's going out, what are the trends, and that's all to figure out what do we have to do right now in the immediate future to be reactive to address the needs. And I'm paraphrasing Errol again, and he always says, accurate data is telling the truth even if we don't like what it says. And first of all, it's beautiful. It doesn't mince words. And I really like it, and I think what would surprise people is just how often we don't like what the data is telling us, right? We have to struggle with that. It could be that we see we are missing an intervention that lots of people need. It could be that we're not even collecting the data to answer a question people are asking us about. And it could just be the worst one, which is we're not performing. That's arguably the worst one. And so we have to not cherry pick and accept the data if it's accurate, right? And so we push for data quality and then act on it or be reactive to it. And then on the other side, you have the proactive, right? So this is the kinds of things where it's like, as a system, we have a responsibility to look ahead, look into the future, see what is coming, and attempt to steer away from calamity. And also, part of being proactive is measuring ourselves. So we measure our own performance to make sure we are good stewards of the funding that has been awarded to us by the government, by private funders, and we have to be proactive about making sure the system is doing what it should be doing. And so the last thing I'll say, I like to say that you've heard the phrase, build the plane while you fly it. I like improve the plane while you fly it. Our job is to improve the plane while we are flying it, right? We have to look ahead for turbulence and birds on the windshield and like whatever, and also maybe even add 2 more engines while you're doing it. So we have a very difficult job, but at the end of the day, it's this balance between being reactive and proactive, and the data helps us to do that. So thank you all. I'm going to pass it over to Dr. King.
Tough act to follow. Good luck, Dr. King. All right, Dr. Ben King. Dr. Ben King is a clinician assistant professional and epidemiologist at the University of Houston Tillman J. Fertitta Family College of Medicine. Whoa. His work focuses on homelessness, health systems, and public health data, including leading the Harris County Homeless Mortality Report and supporting the PIT count methodology for the Coalition for the Homeless and for the Way Home. Ben first participated in a PIT count in Houston in 2006. Wow. And somehow found himself in charge of the PIT survey strategy in Austin by 2009. His hometown is Austin, Texas. Everyone knows about the live music, but if you want the best experience, spend a morning around Barton Springs early and hike up the Greenbelt from there. Thank you, Dr. King.
Let's see, I'm also a wanderer, so we'll see how this goes. This is such a cool room. I give talks to different audiences. I have no idea who's here, and I'm not going to poll you right now, but it's really an honor to get to follow this panel, and that's me mostly hedging because that was a really hard act to follow. Who thought the systems design engineer was going to be such a good speaker? No, John, well, I had more jokes, but I'll stop there. He's really fun to meet with. The team is so amazing to work with. So I'm really glad that I started with this slide because it's good to start with an explanation about why the heck I even need to be in the room, right? Usually when I give a talk about the PIT, they just covered everything there is to talk about. All of the important pieces really are done by this incredible team and done really, really well. So, you know, I have a background in outreach actually, and as somebody who still gets to teach street medicine to medical students, I can't tell you how important it is to be really, really good at outreach and be really comfortable in the way you approach people. And some of the way we train people, but also the reliance on the community of agencies is such a smart way to go. I actually used to like beg to be able to do that in Austin, and they would never let me. And I came here to Houston, and they were like, oh yeah, that's just the rule. Like, that's what we do. So there's that. There's the data collection piece. He's already described a lot of what the data is that we collect, so I'm gonna be able to breeze through that. So again, why do I need to be here? And I think this is the most impressive part from my perspective, is that they let me be in charge of the results at the end of the day. Maybe it's because they don't want to be in charge of the results at the end of the day, but also there's a transparency to that, right? I'm not beholden to whatever, you know, ulterior motive they may or may not have, right? We all want the number to go down for very altruistic reasons, but there are reasons it should go up, there's reasons it should go down, but the reality is, as Errol already pointed out, and you quoted, I love that line, it's like, we tell the data, we say what the data is, no matter whether we like it or not. And so as part of that, they involve a third party. It was actually a mentor of mine, Kathy Troisi, until just a couple of years ago, who's a fantastic epidemiologist. She's gone on, she's now edits the Communicable Diseases Manual. Not that you have to know what that is, but she's a big deal. And so I also didn't, I'm a professor and I didn't bring my clicker. I usually have one on me, in fact, but I'm gonna. All of this is just to lay out the fact that we have a very specific dynamic, basically, and as the third party evaluator, we come in and we get to try to propose different changes. And I'm gonna talk a little bit about that because, again, to John, a point John already made, we can make systems to improve the PIT count, right? That it's not, it doesn't have to be just one thing. I'll be the fourth person to say it. It's incredibly important and also laughably not the whole picture. I mean, it's just really, that said, enough people have taken the PIT count down a step. I'm gonna sing a song called Ode to the you know, unappreciated PIT count. I think it's so important, and it gives us some things that we can do if we treat it seriously and if we take it seriously, and we try to give ourselves the best estimate we can. So this year we've actually implemented a few things that I want to talk about, but I'm quickly going to go through some of the things that we do from my perspective in partnership with the HMIS team, Errol, John, Camille. And what we do essentially is take their report straight out of HMIS and we summarize some of that, right? We understand what the metrics are, what questions are being asked, how they capture that information, and we're able to provide back summaries of particularly the demographics and then the special populations that are of focus that we need to report back to HUD. So all of that's already in the system. We check that, we query it, we work on deduplication steps in particular. We look at strategies for identifying cases that maybe were in a shelter but then also got counted, for example. So we'll talk about the shelter count as well. But we look at, you know, all kinds of elements, including the structure of the housing unit, the family unit that's involved, and we report all of that within the shelter. Almost all of our families, for example, live in shelters, so capturing that effectively. And these special populations you see down on the bottom corner. It's a little bit stickier when you get into the strategy for the unsheltered count. There's, as somebody referenced, right, we can either survey somebody, but they have every right, and sometimes it's with very colorful language, to tell you, I don't feel like being surveyed right now, right? And there's also guidelines for, I thought you were waving at me. There's also guidelines for how we kind of think about what the denial reason might be, where that location is, all of those things, and try to, again, deduplicate to make sure we're not double counting anyone. But we take these two pathways because we get a lot more information when we're able to conduct a survey. Now, we did have a little bit of trouble with the computer system this year and missed some of our demographics on day one, so there was an even larger number of missing values. And so a big part of what we have to do as we're addressing this is compare the differences between the observations that we're able to make, and we can talk about that another time if you want, about what it's like to conduct an accurate observation. That takes a lot of training. And then the survey, and we try to backfill that information. So in the past, we've used just basically a direct, what we call extrapolation, which is basically taking the direct percentages that we had, applying that to the ones that we don't know. But that's a really inefficient way to do that, and we weren't applying it to all of the missingness within the observation. So we were essentially acknowledging an undercount, and we would report the proportions out of all surveys as opposed to the proportions out of all sheltered or unsheltered. And that's giving you maybe an accurate proportion, but not the accurate total number of people who may be in these special populations, maybe in certain demographics. And there may be trends about people who are more likely to be observed than sheltered. I can tell I'm losing the room. This is really fascinating. This is really fascinating statistical methodology. That's not really why you're here. What I want to emphasize is that we used a much smarter approach to estimating these results this year. It is, I'm not supposed to talk about the results, but it is going to be lead to some differences in the interpretation. Again, the thing that's great about the PIT is how useful it is, and its reliability, its consistent use is really important. But we're not going to get a better estimate unless we treat it for its validity as well, for its ability to be precise in its estimation. So using better methodology this year, we're going to have better numbers as estimates of what we see in the unsheltered population. And that really has to do with this approach called multiple imputation. Okay, and I'm not going to get into the weeds on it, but we use really advanced statistical methods. Actually, she's in the room, Carly Strataman, who's our doctoral student at biomedical informatics. Yes, definitely. Yeah. Who took the idea that I had and pitched and wrote out in one set of computer code and sent it to her, and she turned it into the computer code she likes to use in R and just ran it herself. Did an incredible job, and then did it 3 more times because we kept making changes. And so this is the kind of thing that we can do to kind of help assist. It's going to lead to an improved estimation, and that's the end of my point there, thankfully, for everyone involved. And I really appreciate the time. Yeah.
Thank you, Dr. King. And to his student, thank you so much for coming today. Thank you. All right. I don't know how to put this back. Okay, I think that's right. Well, I really want to thank my co-panelist, Tony, John, and Dr. King. Thank you so much for being part of this. I really appreciate this conversation because I hope what we grasp today is the PIT count is more than just one activity, that there are a lot of things that happen behind the scenes. And before we move to Q&A, I just wanted to talk about what I think our community should be proud of, not because the account is perfect and not because we are proud that homelessness exists. We should be proud because your community shows up. Your community answers the call. Volunteers show up, providers show up, people show up, outreach teams show up, coalition staff shows up, governance partners, local jurisdictions. I think this year we had the most ever elected officials involved in the point-in-time count. Community members play a role when possible. And at the same time, we have to be honest that we know that there are gaps. We know the PIT count does not capture everyone, but that is the larger part of this work that we all do. The homeless response system cannot be the only safety net. We need healthcare, behavioral health, justice, child welfare, schools, workforce systems, housing partners, local government, philanthropy, and community organizations to all work together and help identify risk earlier so that people do not have to be part of a point-in-time count. The point-in-time count helps us understand one part of the issue, but the larger work is year-round. It's data, it's accountability, and it's coordination. For the way home, the future different methodologies may not look like accounts every day. Some communities do a count once a week. Our region may need a different model, but the direction is clear. We need stronger year-round engagement, better documentation of engagements, and better visibility who is unsheltered and the support they need. Ideally, the point-in-time count becomes less about finding people every January and more of a roll call because we've already had those engagements. We know these individuals and we know the journey. So that's where we hope to go in years ahead. This future requires support. It requires community support, again, government support, philanthropy, partner coordination, data practices, and continued investment in our system. So if you remember one thing from tonight, I hope it is this. The pit is one day, but individuals and families experience homelessness 365 days of the year. The count matters because people matter, and what we do with this information matters even more. My call to action is to stay involved beyond tonight. Get involved with the social service agency, become part of the way home, become part of a homeless service agency, volunteer somewhere, be part of the solution. The pit count is one moment of the year, but the work is year-round. Thank you.
So now we have time for some audience Q&A. So if we could actually have all of our speakers return to the stage. Sorry, Renee. And I will come around with the microphone. And just a friendly reminder, a question ends with a question mark. Thank you.
Hi, everybody. So I have a question. So as you talked about refining the pit count year over year, trying to make it more accurate by changing some of the way you collect the data, the way you data model the data, are you concerned that year over year those measurements are going to be distorted?
Yes and no. There is going to have to be a clean break, and we've already talked about this as a group that we won't be emphasizing year-over-year differences this year because the estimation method changed. And again, the only thing that's good about the pit is its reliability, but you still need it to be of a certain quality to get there. And so you have to make the change at some point. The best time to plant a tree is 20 years ago. The second best time is today.
Oh, John.
I would also add that while Dr. King and I haven't had a more detailed discussion, the broader, so at the very start of this, Renee or somebody described, sometimes the pit count can just look like pulling the services out. Was that you? Out of HMIS, right? Those are, doing that and doing what we do is very different. And I would just kind of add on to what Dr. King said. We're still going, for the foreseeable future, to my knowledge, to be sending people out to talk to we're still going to be interviewing people and observing people, but we are making changes to get even better and better at, among the interviews and observations, making those as good as they can be. Yeah? Okay. That's all I wanted to add. Yeah. So basically, the methodology is mostly retained, I would say.
So I'm Shanika. I'm with Community Development in Fort Bend County. And I live in Houston, but Fort Bend County looks very different. And so we were out on the streets. We only talked to maybe 3 or 4 people, just me and my coworker. So what can be done differently in Fort Bend County? Because as you talk about We are talking to the elected officials. We have them out there. We're trying to do this, but the numbers are not reflecting the same thing. And they think in Fort Bend County, because it's one of the richest counties, that they don't suffer with homelessness or unhoused, right? So what can we do differently to get those numbers so that we can make sure that they're equally represented?
I'll start this one. I think we always try to make sure that when regions are assigned, that they reflect the community. And so in Montgomery County, we make sure that Montgomery County organizations are counting those maps. In Fort Bend County, the same. I think with Fort Bend County, we could do better at in-reach possible counts, similar to what we do in Montgomery counties. We have Compassion United out in Conroe, and they help count individuals that are part of their days center. So I think, of course, there's opportunities, and we're happy to talk about ways we can better reflect what Fort Bend County is experiencing.
And like Renee has been saying, you know, the pit is not just one day, it's the whole year. So if there's places that you guys know of, let us know that, because when we do the maps and when we decide who's going where, if we know where someone is at, we're going to go out there, we're going to find them. So definitely giving us that information whenever you have it, not just waiting until pit time, would also help us improve.
Hi, Viviana, Common Thread. How do you guys count for transitional living, since it's part of like the homeless? Like, how do you guys deal with the pit and the count through transitional living facilities?
Yeah, so specifically, that data will come out of the HMIS. It'll be all of the individuals that are actively, well, every single person, yeah, that is actively enrolled in a transitional housing project. And of course, we will break it down by the different household types, right? Individuals with children, families with children, adults without children, children-only households, that kind of breakdown. But really, we just essentially query our system and look for everyone that is actively enrolled. Does that answer your question? Okay. Anyone else?
I think just speaking of that, your project has to be part of the Homeless Management Information System, so HMIS. So if you're not part of that, then you are not counted if you're a transitional housing project. So if you do have one, please contact us. We have, again, partner engagements. We want as much data as we can have within our systems, so please let us know. Yes, we didn't get to some of the slides, but maybe I just didn't click through the slides. But yes, our region, we break up our entire COC in smaller map areas. And so there were probably, 300 or so map areas, and each team is assigned one map area every day to count. And so we do go all the way out, almost touching Sam Houston Forest, very, very far within Fort Bend County. We go everywhere within our COC region. So yes.
It's not so much like they have to be in Harris or
No. Yeah, the area. Yes, ma'am. Yes, sir.
So in Houston, is the pit count done on just one day? And if so, is it the same day every year?
Yes and no. It is done within we do a 3-day count within our COC region. Day 1 is everything within the 610 loop. Day 2 is everything east of 45, and day 3 is everything west of 45. And so we try to count within those days, within those regions. What's the second part? Oh, yes, the same night. And so we asked the question within the PIT survey, what night were you experiencing homelessness? And it is always the night that we identify. So usually it has to fall within the last 2 weeks of January. This year, due to weather, and actually weather issues the past 3 years that we've experienced every last week of January, We moved the count to the last week of February, which was a much more stable weather environment for our system. So we most likely will continue to hold the count the last week of February for our region.
Now it's time to ask those burning questions about the pit count.
Hi, two questions. How does our pit count differ from other cities or other COCs? And do we make an effort to share best practice so that that data can become more comparable?
You want me to take this one? It does differ because, as we keep saying, we have a much larger area to cover. So some are able to do their pit count in one day or one night, where we do spread it out in 3 so we can make sure we're covering our whole COC. And what's the second part of the question?
Do we share best practice?
Oh, yes.
I mean, of course, yes. We do trainings, and we, if anybody asks us for our best practices, we're always willing to share them.
I'll jump in on. So I think it's a great question, and with something, this is called a point prevalence estimate, and I know that's the technical term, is a very specific, as many people have said at this point, a very specific measure of the volume for a given system. But that is really different for different cities. So I've spent a lot of time actually at the national level talking about how cities like Austin and Nashville, Seattle, and actually, although we don't get credit for it, Houston, cities that have a lot of green space, don't have this, or have a whole different set of barriers than cities. I mean, New York City gets to count, and there's not nearly the same kind of difficulty of, what did you say, it's the size of Yellowstone? I didn't actually put that together until I saw her slide. So there's a huge difference. And so really aligning the methodologies across different system and city structures is a really interesting problem to assess because we're all doing it a little bit differently. And there are some really new, cool, cutting-edge approaches that we are going to be weaving in. I'm told that we're on board with weaving in some really new thinking about how to get better estimation methods while still doing the count the way we do it, to get better estimates as well, because there are cities like Seattle who have pioneered a completely different approach, which is much more statistical, much less of this idea that we have to literally shake every person's hand in order to count them. But I think the solution is by doing multiple things to get a better estimate always. And so, yeah, those best practices, those are happening at national meetings and all kinds of other spaces that we all go to at different times.
Question for clarification on transitional housing. I'm sorry. I don't know if this is. So if you had examples, or can you describe what's transitional housing compared to the shelters or permanent supportive housing?
The technical term for transitional housing is housing up to 24 months with extensive services. And so the individual has up to 24 months to be part of the program, be engaged in wraparound supportive services, and then exit the program to stability in whatever that means for the individual.
I heard a great phrase that describes transitional housing today. It's called a bridge, not an end. So it's a bridge for people, but it's not the end. That's why we still consider them to be experiencing homelessness.
So to be clear, you could be actually at the same address, and if you're there 2 years or less, then it's transitional. If you're at that same address for more than 2 years, it could be permanent, or what's the?
So it all depends on the program type that you are part of. And so let's say somebody's enrolled in a transitional housing project, you can only be in that transitional housing project up to 24 months. And we hope that with the supports, your exit is to a pathway of stability and whatever that means for that person and their journey. There may be times where transitional housing is a bridge and they need additional supports into a permanent supportive housing environment. And so that's where they would then exit transitional housing into a new program. Yes.
Charlotte Garner, and I am a part of this organization, their Consumer Advisory Council, among a whole bunch of other things. The transient nature of individuals who are housing challenged, the new politically correct term, housing instability, lends that services are available to those people for the most part during the work day or during the day hours. Has there been any conversation, I'm piggybacking off of the gentleman that talked about how other places do theirs, of possibly going out at night or dark when they're usually bed down or stable or not moving around as much to improve the numbers?
Of course, yes. I think we're always looking for ways to improve our strategy and ensure that we have the accurate counts. But again, the count is only that one day of year. There is much more data and better data across the 12 months to really track and engage with an individual experiencing homelessness. So again, although we appreciate the point in time count and want to continue to utilize it as a tool, there are additional tools that help us tell that longer story and help meet those gaps for our system. Anybody else?
Hi, Shonda Blocker. I run a nonprofit for mental health. I'm kind of curious, and you may have said this, but I may have missed it. I'm really interested and curious about the standardization or lack thereof between cities and principalities about how it's done. Who makes that decision on how the count goes?
HUD, the Housing, Urban and Development. They give a simple framework, and I think you could hopefully still find it on their website, about how to conduct the point in time count. But it's very different across communities. I was doing a little bit of research on Chicago and how they conduct their point in time count, and it's different than how we conduct it in Houston. LA conducts it, I believe, as a service-based count for some of their areas, and then as an in-person count on some of the regions as well. So at times they're merging two different methodologies. So it is very different. I know that HUD is interested in improving the point in time count structure across the nation to make it a bit more uniform. So we'll see what they come out with over the year.
Data sharing warehouse across all of the HMIS programs, in which Houston was one of the pioneering organizations, and the balance of state is the host. And so they're able to look at service interactions that cross over and look at how many people are exchanging between programs in your area and in the COC here, which I think is a huge opportunity for a number of different reasons. But yeah, so your service providers are able to query what services are being accessed in Houston and back and forth, which is, I think, important. Yeah.
My neighbor's question to the left over here about people that may be homeless by choice made me think of another question. Could y'all kind of talk a little bit about the questions that are on the survey outside of basic demographic information? Like what conclusions can we draw from that survey?
I wasn't sure which way the mic was going on that one. John and I had a lot of meetings about this. And I think there's a couple of things that need to be emphasized. One is the better we can compare the questions as they're asked in the shelter already when we're asking them in the survey. That's so important, and we're going to continue to improve on that. But we made a lot of changes the last couple of years so that we can compare sheltered and unsheltered prevalences as apples to apples and not oranges. So that's goal number one. And then we let community priorities drive a lot of the other things, asking about their causes of homelessness, including questions about whether or not it was related to a natural disaster, which is obviously an important policy issue in Houston area. Okay, now I'm going to start blanking, and there's another dozen questions that we've filtered through and we edit a little bit, but the main thing is trying to get accurate understanding of either prevention or barriers to services are the main two functions of that. Yeah. Is anything? Okay. I think you covered it.
I think all the questions have been answered.
So I'm Kelly Young, and I'm the president and CEO for the Coalition for the Homeless, and thank you so much. Thank you so much for coming out tonight. A really big round of applause for our lovely panelists. I was sitting here and I was listening to him, and I was thinking about, first of all, when we were talking about it beforehand, we're like, this is going to be a really nerdy presentation, and it was. And so, well done. But second of all, I think we could take it on the road as a comedy show. Like, we were pretty good there as well. So I want to thank you all for being here. I'm always greatly appreciative and impressed with the people I get to work with and all the people that worked before me to actually make all this work so impactful and so amazing. And so I want to recognize everybody in the room who's been a part of the coalition. Anna's standing right there. Just in recognition of it took a long and a group of people to put all this together. And what you can notice about it is that this is a really talented group of people who could be doing lots of other things, not trying to solve one of the most difficult problems in society. And yet they show up with humanity and their smarts and they're willing to collaborate. And I am forever grateful I get to do this work. You can tell that we are very data-driven. I think it's an untold story often about Houston. People like to tell the human story of homelessness, and I totally get that, and I think it's important. But if you only tell the human story and you don't create systems and ways to solve for the human problem, we're never going to get anywhere. And so the fact that people sit in rooms and have these conversations and figure this out, and often are unsung heroes that nobody hears about, I'm forever grateful that that's also a pillar of the work that we do. Someone said very early on that each data point is a person. And one of the things I always think about this is how quickly people bridge over the fact that you may want more out of the pit count, but that requires somebody to go up to somebody who is having one of the worst times of their lives, having a difficult day, knowing that they're not going to have an answer at the end of that interview, and still give us information. And so I get when people say they want more and they think we should be telling more and doing more. You have to remember the other side of the equation is that this is a person sitting there wishing their life is going to change and hoping somebody's going to be able to give them something, and they get asked a bunch of questions. So when people challenge how this is done or the way we do it or any of those things, I want you to remember the other side of who sits on that survey, and remember that they are gracious enough to give us the time and energy to do that. And we are cautious about how many observations we accept so that we are not overestimating and labeling people in that way. The other thing I wanted to mention is the collaboration. Without Dr. King, without anybody of our collaborative partners, this would be almost impossible at this point, Renee, I would think. And I remember, because I was on the other side, I was a provider before this, and I remember when it came down, I was like, you will have 3 people. And now, I'm pretty sure we showed up every year, so I'm gonna cross my fingers on that. But by the time you said it was mandated, by the 3rd year, people were just doing it. It was no longer. So when you ask people to step up, they will step up. If you tell people they will step up, they'll stay stepping up. So, it's not a bad thing to ask people to actually participate in things that might be uncomfortable for them. This is very strategic. As you notice, they're already thinking about how to do things differently and better, and that is at the core of CFTH. We just had a call yesterday with somebody who wanted to sell us something that we were like, well, we already do that. But if you need a guinea pig on something, if you want to try something new out, happy to have a 30-minute conversation with you. So hopefully we'll talk to him next week. I think the other valid piece that I want to mention is the transparency that we try to share around everything we do at CFTH. We're not hiding behind some number that we can't explain. We're not making something up. These are intelligent, thoughtful, intentional people who want to give us the best data to be able to make the best decisions. But it is also a requirement from our funder, and we know that as long as we have a requirement from our funder and we want to get money from that funder, we're going to do it better than they ask so that we always show up, not just for the funding, but for the people we serve and doing it in the best possible way. And then lastly, I also just wanted to mention the validity. I love Dr. King so much, and he and I are not allowed to talk on the same stage because we will go off for hours on all sorts of random stuff. And I like how he cut himself off, and I noticed that John did the same thing because their brain goes into all sorts of stuff, but all of it is to test to make sure that the data that we produce is valid, that you can trust it, that it means something, and it's not just something that they came up with because, you know, somebody told them to. And I greatly appreciate the focus on the validity and reliability of our pit count. I think if you didn't get it from the beginning, I'm going to finish with it, which is we need to understand what it is, and we need to honor what it does. And if we understand those two things, we will place it correctly in the category of all the data we use to address homelessness across the region. And with that, all I want to say is I hope you have a lovely evening. Much love and appreciation for you all coming out. And please finish up the food, because we always have to drag it back in our cars. All right, have a good night.